The activities of the Center for Global Health are not just geared towards infectious diseases. Both Professor Dresden and myself have a background in infectious diseases, one more on the pathogen side, the other more on the host side in vaccinology. But there are many other important topics in global health, for example, mental health, for example, non-communicable diseases, for example, AMR, for example, digitalization, and many, many aspects. And people who are experts in those aspects, I hope, will feel equally invited being part of the center. There is a major academic network function in the job that I've just taken on, and I think we can provide hosting diverse groups and initiatives. We can provide forums where people can present their work. It's really their work, and that doesn't take anything away from anybody. And we need to put in joint-up grants through academia, through the Center for Global Health, to give momentum to the collaborations. I think this is, where I'm placed. I'm an academic primarily. I'm also a clinician. So I think academia has an important role to play because they're major drivers in innovation, but also in education. And we need to open up facilities and knowledge to colleagues in resource poorer settings as well. And we need to listen to the needs from the people on the ground, because we don't know what people need unless we ask them. And I think it would be a fantastic opportunity to offer a global health PhD program, to offer postdoctoral fellowships, and to really embed in this multidisciplinary field of action that global health represents. And we have so many fantastic key experts in Berlin universities and across Germany as well who can contribute to this. If I had to think about indicators of success, and that's something that obviously I have to think about very, very carefully now, I'd like to mention three things. One is that the Charité Center for Global Health becomes an internationally recognized center of excellence for global health expertise, and that relates a little bit to my answer to the last question. And that local and international partners can achieve visibility and sustained collaborations. And it's really important for me to bring in our global partners into this endeavor of visibility and interactions. And then the third one, which I've also briefly mentioned, that for the funders from German governmental agencies, investment in global health happens in a spirit of trust into partnerships that already exist, and also to trust that funds can be administered by other institutions in a reliable and verifiable way.